Module 3, Calculating Oxygen Content. In this module, we will focus on equations involving oxygenation. Let's begin. Your learning objectives for this module are to understand the definitions of PaO2 and oxygen saturations, and to review the oxygen content calculation. There are several terms that are important to understand before understanding the respiratory equations that involve oxygenation. The first term is PaO2. This is the partial pressure of oxygen in the plasma of arterial blood. You can also think about it as the amount of oxygen dissolved in the plasma. It is important to recognize that PaO2 only accounts for the free oxygen in plasma, not any oxygen bound to hemoglobin. If you want to know the total amount of oxygen in blood, then you need to calculate the oxygen content, which we will be reviewing shortly. PaO2 is determined by the alveolar pressure of oxygen and is completely independent of hemoglobin. As a result, infants with severe anemia, carbon monoxide poisoning, or methemoglobinemia often have a normal PaO2. However, if there is a VQ mismatch, decreased alveolar ventilation, or right-to-left cardiac shunting, the PaO2 will be reduced. The next term to review is oxygen saturation, defined as the percentage of heme binding sites in arterial blood that are saturated or occupied by oxygen molecules. Remember that each molecule of hemoglobin has 4 heme binding sites, and that there is an equilibrium between free dissolved oxygen, measured by the PaO2, and bound oxygen, measured by the oxygen saturation. As a result, the more dissolved oxygen there is, the more oxygen molecules available to bind to hemoglobin, and the likelihood that the oxygen saturation will be higher. Therefore, PaO2 is a determinant of oxygen saturation. The other determinants of oxygen saturation are those factors that shift the oxygen dissociation curve to the right or left. The oxygen dissociation curve will be discussed in depth in another program. It is important to note that the O2 saturation isn't affected by the amount of hemoglobin available, as patients with anemia can still have oxygen saturations in the normal range if the available hemoglobin is fully saturated with oxygen. Oxygen content is used to determine how much oxygen is in the blood and has a unit of measurement, milliliters of oxygen per deciliter. Oxygen content can be measured directly or calculated as shown here. The total hemoglobin concentration is multiplied by the oxygen saturation and the concentration of oxygen per gram of hemoglobin. This determines the amount of oxygen that is bound to hemoglobin. The PaO2 is multiplied by a constant of 0.003, which is milliliters of oxygen per millimole of mercury per deciliter. The two values, freely dissolved oxygen and oxygen bound to hemoglobin, are added together to determine the total oxygen content in arterial blood. Hemoglobin concentration and oxygen saturation have the most effect on oxygen content, while PaO2 has minimal effect. Remember that when we multiply by the constant 0.003, the PaO2 becomes a very small percentage of overall oxygen content. In this module, we discuss the concepts of PaO2, oxygen saturation, and reviewed how to calculate the oxygen content. The oxygen content equation is used frequently in respiratory equations, and one should be comfortable with it. This concludes Module 3. Thank you for your attention.
We would like to acknowledge the American Academy of Pediatrics, the Organization of Neonatology Training Program Directors, Neo Reviews, and Abbott Nutrition for their support of this educational program. This concludes this module.